Continuing our series of conversations with 9 News Director of Reporting Chris Vanderveen, who's been our point man on COVID-19 coverage. Chris, we always have these conversations socially distanced. This is the first time we've had one of these since I've shifted back to part-time at home. It's a change that a lot of businesses that are able across Colorado are making simply because if you can do it, it's safer for everybody involved on your end, mine, everywhere.
Yeah, the shift is on here in Colorado, Kyle, where a lot of people are making changes in their lives. We have seen a big shift in terms of the tone that people in government have been using. There's really a considerable amount of worry, and that's causing a lot of people to maybe go back, work at home, such as you're doing right now, and really sort of change up what's going on, because there's a huge worry going into next week being Thanksgiving, that what is that going to mean to the case counts?
If pre-Thanksgiving we're seeing situations where there's a hospital in Pueblo that has reached ICU capacity, there's a hospital in Mesa County on the western slope that's reached capacity, it seems like we're in a pretty dire situation, and we are not yet at the worst point.
Yeah, consider what's going on or what happened in Pueblo and Grand Junction as a bit of a preview of what's to come. They can manage it. When it's one hospital at a time, whether it's down in Parkview in Pueblo or in Mesa County, they can manage that. And what you're seeing is that those hospitals can sort of ask other hospitals for transfer help, and that's what's happening right now. But sooner or later, when more and more hospitals run into that area where they're at 100% ICU capacity, that's when the problem happens, because they can't transfer other patients to other hospitals as easily because those hospitals are starting to fill up. It becomes a bit of a mathematical equation in essence, because once you start to fill up so many areas, you run out of options in terms of where to bring patients. They're not there yet, but they're getting close, and there's worry that they will get to that point maybe in the next week or so.
I know that we don't want to indulge fantasy, but we also know that there are people who still believe that COVID-19 is a hoax. But what we are going to start to see is this impact medical care for all kinds of things that no one thinks is a hoax, like a heart attack or a stroke or a car accident.
Yeah, when you start to fill up the facilities themselves, you start to see things that start to happen when people show up, and there's just not a lot of room for them. I think that we've been filled with this idea, they're sort of living in this world where sort of COVID, if you didn't know somebody involved personally, it's sort of this existential, not really sort of direct threat to your life. And now we're starting to see it really start to ramp up in ways that we're seeing it directly. We talked about this last week, where we're starting to know a lot more people that have COVID. That's direct, but when it starts to impact people who don't have COVID, and that's always been the worry, Kyle, is that the facilities are going to fill up in such a way that when you show up at Hospital X, there's less room for flexibility when they're filled up with a bunch of COVID patients. Hospitals are already generally full around this time of year and going through March and April, simply because it's just sort of upper respiratory season. You have a lot of flu cases. Now add on that a couple thousand COVID patients around the system, and you're really starting to tie up a system that doesn't have a lot of flexibility to begin with, and it loses even more flexibility because of the situation we're in right now.
We hoped that even with cases and hospitalizations surging, we hoped that maybe with better treatments and less stress on the healthcare system, that the surge in deaths in Colorado would not come. It's a hard figure to track, but it's pretty clear that deaths are significantly rising.
And I think that's what I saw specifically this week, Kyle, is that deaths are absolutely 100% up, and you can see it in the charts. We were averaging about 3 to 4 deaths a day about 2 months ago. We're now seeing 20 to 25. At the peak back in March and April, we were seeing roughly 30 deaths a day. There is a thought. There are models out there now that suggest by Thanksgiving Day of next week, 1 week from today, we will be seeing more deaths in the state of Colorado than what we've seen per day than we've seen since the start of this. We're getting really close to that. We all know death data lags, but we're seeing an indication that deaths are on their way up. And I don't think you can't deny it now. The numbers are there. The figures are there. Deaths are up in the state of Colorado.
So we know that 15 counties, at the very least, are moving to the new red status tomorrow on Friday, including most of the Denver metro area, which pretty strict crackdown on indoor dining, no private gatherings, even outdoor events are limited, indoor events are prohibited. The state's now saying it's going to reserve the top notch on the scale, purple, for when hospitals are overtopped. I think when we first heard that, we thought, okay, well, the state's just not going to lock down anybody ever. But now we can foresee this scenario where, starting with maybe some of the smaller rural facilities, the healthcare system is overtopped. That happened fast.
This is a situation now, Kyle. We talked a lot about PPE back in March and April. PPE, for the most part, is good. This is a staffing issue. And when hospitals start to fill up in a way that they don't have the staff, the correct staffing ratios to adequately care for the patients in which they want to, they're going to raise that flag, and it's going to make more counties more inclined to sort of say, hey, we need some extra help. We're at that red phase now, a number of counties, as you said, around 15 counties in the state of Colorado, moving to that red starting as early as tomorrow. The next phase after that is that purple phase, where it's more of a complete lockdown. Red is almost a little bit of a lockdown light. Purple is really what we saw back in March and April. They don't want to do that, but if the hospitalizations dictate it, we will see it.
Last question, Chris. I know a lot of folks have had one-on-one conversations with us via social media and via email over the course of our reporting on the pandemic for the last 9 months. So there is some interest in just kind of how do we see things playing out at this point. I think it's important for us to just come right out and say, like you and me, like, we're not pulling a Governor Gavin Newsom situation where we tell people publicly, don't gather in groups and take precautions, and then nighttime we're going to Napa Valley to party at restaurants and so forth. Like we are doing the things that we are asking our neighbors to do because we're relying personally, you and me, on the best advice that we can get from health experts.
It's a tough situation, Kyle. I've got my mother at home who lives in the house that I grew up in, and she's living by herself. And Thanksgiving is obviously next week, and there's lots of things that we would like to do as a family. This is my mother, who really hasn't been outside a whole lot in the last 8 months. And there's things that I'd like to do. I'd like to protest my government by simply meeting her and saying hello to her and meeting with her inside and saying, yeah, this is an idea of patriotism. But at the end of the day, I'm not going to be able to live with myself if I'm the one who ends up getting my mother sick at the age that she's in right now, and because she hasn't been outside because her son came inside her house at Thanksgiving and got her sick. That's crazy to me. And you live it, I live it. This is not a hoax. This is as real as it gets. I've got a twin brother, who's an ER physician, who's seeing these patients on a day-to-day basis. This isn't a hoax. This isn't a joke. This is as real as it gets. And I hate that we have to be that honest. But I also think what we've lacked in the last 6 months is a dose of honesty. And I think part of the reason that we're in this spot where we're in right now is because we haven't been honest with the situation. We've sort of joked about it. We've laughed about it. We've talked about sort of fear porn and all those type of things that reporters like me and you get online. And yet at the end of the day, talk to an ER physician. Talk to a nurse that works on an ICU floor and ask them if this is real. And they will tell you 100%, you're damn right it's real.
Yep, it's real. Choices matter. People still can make good choices in the coming weeks and have an impact on this. Chris, thank you.